Kiss of Death presented by the Chagas Disease Fighting Task Force. Maria lives in the El Gato Colonia in Donna, Texas, which is part of Hidalgo County, about 30 minutes from the Mexican border. She has been living in this community for as long as she can remember, even raising her 2 children in the same house she grew up in. She has been feeling sick for the past few days, but nothing too serious, just flu-like symptoms like fatigue, vomiting, and fever. She did seem to develop a strange swelling on her neck. She recently lost her job at the restaurant, so to save money, she decided to go to Mexico to get a diagnosis. Going to Mexico is generally the cheaper option since it is closer than most of the providers who accept non-insured patients in Texas. The provider was unable to give her a clear diagnosis. He told her to treat the flu-like symptoms and gave her antibiotics for the swelling. 2 weeks have gone by, and yet her symptoms have only worsened. One day, as she was getting ready to pick up her kids at school, she felt herself falling. Next thing she knew, she was at the ER. They told her she has Chagas disease.
Chagas disease is a tropical parasitic disease caused by the Trypanosoma cruzi parasite. It is spread by the insect triatomine, as seen on the screen, also known as the kissing bug, as it tends to bite people around the eyes and mouth. Chagas manifests itself in flu-like symptoms and can come in either the acute phase or the chronic phase. While most people in the chronic phase are asymptomatic, approximately 20 to 30% of them can develop serious conditions, such as an enlarged heart failure, or gastrointestinal complications, such as an enlarged colon or difficulty eating. It is difficult to determine a precise case of Chagas disease in the United States since most states are not required to report cases. However, scientists like Dr. Peter Hotez, a vaccinologist and infectious disease expert at the Baylor College of Medicine, estimate about 1 million cases in the United States and nearly 37,000 cases in Texas. Within Texas, there is a particular concern for a significant disease burden at the U.S.-Mexico border, particularly in Hidalgo County, due to the housing conditions known as colonias. Colonias are substandard housing lacking basic services such as potable water and proper draining, making them a hotspot for Chagas transmission. A combination of intense heat, conditions in the colonias, and lack of education makes South Texas, especially Hidalgo County, a hotspot for Chagas disease.
As a task force, our goal is to prevent transmission of acute and chronic Chagas through education of the general public and healthcare providers on prevalence and prevention of Chagas disease, ultimately reducing T. cruzi infestations in Hidalgo County. We plan on accomplishing this through a 3-pronged approach of education, blood donation, and pesticide spraying.
Our purpose and main goal is to prevent acute and chronic Chagas disease through education of the general public and healthcare providers on the prevalence and prevention of Chagas disease in Hidalgo County in order to reduce T. cruzi infestation. Our logic model shown is broken down into inputs, activities, outputs, and outcomes. These outcomes are broken down further into short-term impact, intermediate impact, and long-term impact. For our inputs, we have approval, medical records, funding for our intervention, and media campaign. Also included in our inputs are stakeholders. These are our key stakeholders that we will work with, including Texans for Public Health, Hidalgo County, residents of Hidalgo County, the clinic, Mid-Valley Pest Control, Vitalant, and Red Cross, who are the blood donors for our intervention. Activities include training our clinic staff through intervention, pamphlets distributed through multiple community events throughout the 4 years, and our partnership with the blood donor services to conduct screening and to include Chagas in our screening list. Also, we would want to design social media campaigns to encourage blood donations. We want to spray down houses, partnering with the pest control company. And we want to conduct pre and post interventions. And our main task force would be our infectious disease and data analysts who will be able to conduct these pre and post research. Our outcomes include cases before, during, and after the intervention, evaluation of these cases, lower levels of T. cruzi infestation, more accurate rates of Chagas through blood donation screening, increased awareness in our target population, and surveys done during the events. Our short-term goals include, short-term impact includes established current number of cases, proper usage of the materials such as our equipment and supplies, yearly evaluations of the clinic, increased public awareness and engagement with the intervention. Our intermediate impact would be decrease in prevalence and incidence of Chagas, tracking of the goal year to year for the 4 years, and continuing to monitoring cases post-intervention. Our long-term goal is to see a decrease in morbidity and mortality of Chagas disease in Hidalgo County. We want to permanently increase public education to combat this disease, and we also want to have sustainability. So it's going to be an ongoing prevention, and hopefully we will see a decrease in T. cruzi infestation. And also we want to have a positive impact on the population.
Our 3-tier approach. Our approach 1 is to raise awareness of Chagas disease in Hidalgo County. Currently, the issue is not popular discussion in the community. By educating the people of the community, we will be able to start an important discussion within and among the people. Bringing the discussion to light will help us make progress towards our goals, and some of the ways we can do so are by partnering with different clinics such as Nuestra Clínica del Valle. Another way is to partner with individuals from the community that will serve on the task force. And these community members, known as the community liaisons, will be our link within the community. We also want to hold different activities such as community events, where we can inform the public about the issue using pamphlets as an example. Social media will play an important role in advertising the importance of this issue. Our most important activity will be educating the current healthcare professionals present in the community, so in turn, they can spread the knowledge once they have learned. Our next approach will be to use blood donation screenings. Currently, there is no automatic testing done for Chagas disease. By partnering with American Red Cross and an organization called Vitalent, we will advocate for people to donate blood that can save potential lives using incentive-based programs. The effects for this approach will be an ongoing process with the goal of adding Chagas disease to the blood screening process, just like it was done for Ebola in the last 5 years. Our third approach of this 3-tier process includes partnering with Mid-Valley Pest Control Service in Hidalgo County. According to the World Health Organization, medical care cost of patients with chronic cardiac, digestive, neurologic, or mixed form of the disease due to long-term Chagas has been calculated to be greater than 80% than the cost of spraying residual insecticide to control the different vectors and prevent possible future infections. We will select from 5 volunteer families and households that will be the first for spraying, and after assessing the results pre- and post-spraying, we will implement further households from the community and add on our process in the subsequent months after the first 5 testing. Bringing our approach together, our main focuses in summary are using education, blood donation screenings, and elimination using sprays. We can make an impact on this disease for the future of the community and the disease overall.
During year one, we want to focus on the education portion of our intervention. In this time, we will host 3 community events to start gaining some momentum with our community members and start building trust. By year 2, we will train the staff at the local clinics on how to identify Chagas in patients. Most importantly, we will start negotiating with blood donation companies, including the company Vitalant and later the American Red Cross, to include Chagas as a screener in their labs. In the beginning of year 3, we want to find 5 families who live in colonias to volunteer their homes for pesticide spraying. The families will be given incentives for volunteering. We will then assess how much the T. cruzi infestation decreased in these homes, comparing them to an initial assessment by the pesticide company. If the change is significant, we will continue spraying other colonias in the area during this year. And finally, in the last year, we want to focus on training other professionals in the community to continue the work as our task force leads. We will do a final evaluation of community and clinic members to assess any changes we can make for further interventions on Chagas disease. We will host a final community event to wrap up our intervention.
Looking at our budget, our intervention is projected for 4 years, given a budget ceiling of $2 million. $500,000 is given for each project year. The funds allocated per year vary based on personnel and fringe, which include full-time and part-time employees. Fringe benefits are given to full-time employees only. Our personnel includes an infectious disease expert, social media administrator, program manager, program coordinator, community partnership liaison officers, a data analyst, an event planner, a graphic designer, and interns. Each member of our task force has respected roles and responsibilities and contribute a different % effort every year for the 4 years, and some personnel are given a raise in their base salary based on the more effort and rigorous contribution put forth to this intervention. Majority of our budget is for personnel because each year that cost varies depending on what we are accomplishing in our timeline. As you can see, personnel and fringe has increased from about $343,000 to about $418,000 from year 1 to year 2. Also included in our budget per year are office operations, which include general office supplies and our advertisement budget. Equipment is included such as event supplies and food. Supplies include pamphlets, gift cards for program participants in the community, survey copies which pertains to knowledge about Chagas disease. Additionally, there will be meeting costs, technical support, and a contractor added to the budget. Every year, a contingency fund of the amount 2.5 of the finalized budget that year is taken into account for unforeseen expenses. The major difference from year 2 to year 3 and year 4 is that a contractor is added for insecticide spraying of multiple households in Hidalgo County. Our overall goal is to prevent Chagas disease through education of community members and healthcare providers on the prevalence and prevention of Chagas. We want to ultimately decrease infestation in Hidalgo County. So every year, we hope to see results based on our 3 approaches and goals set forth mentioned in our timeline. Success is measured year by year. In year 1, our goal is to increase awareness through surveys and holding community events. For that year, our success will be measured by having 50% of the community in Hidalgo County aware of what Chagas disease is, what are the symptoms and effects it can have. Throughout the year, we want residents of the county to know who we are, the task force, and we want to build trust with community members through active listening and proper communication. In year 2, we will partner with Vitalant and Red Cross, and our main end result for that year is to have these blood donation service providers incorporate Chagas in the screening list, which would allow us to identify the rates of Chagas when people get tested. To promote increased participation, there will be incentives for more community members to donate blood and more social media advertisement. In the following year, year 3, after building trust with residents, we will be able to partner with a contractor and spray down households. Success will be measured by having 5 houses sprayed by insecticides. In the end of this year, knowing the rates of Chagas before spraying these houses and after spraying these houses, we hope to see a reduction by 50% of this disease, and we will continue spraying colonias. For our last year, year 4, 55 homes will be sprayed for insecticides to eliminate T. cruzi infestation. Our blood donation partnership with Vitalant and the American Red Cross will continue. As we end this year, our main priority will be sustainability. We want to maintain our services and activities for ongoing prevention. To do this, we will transition our intervention to local health workers to have this long-term sustainability of decreased Chagas rates.
Maria passed away a week after being admitted to the ER. She is one of many residents of Hidalgo County who are either misdiagnosed or do not receive proper treatment due to the lack of health insurance and the lack of understanding of Chagas disease. Chagas is an invisible threat, killing millions every year. Chagas has even changed my life because it took my mom, Maria, away from me. I worked as one of the community liaisons of the task force on Chagas disease. In the backdrop of my personal tragedy, I learned that we need to work together and take initiative to combat this terrible disease. We need to spend resources on educating the community members and providers about the disease right now to prevent cases in the future.